Hello friends. So what do you know about drugs? What are drugs? See, in the medical terms, whatever the medicines we use, okay? What all are the medicines? They are drugs. Okay? So drugs are medicines. Now, the drugs are of several kinds. You must have noticed something written behind that the tablets, that Schedule H drug or Schedule something drug. So Schedule H drugs are the drugs which cannot be taken without the prescription of a medical prescription. Okay, so they are the drugs. They are to be taken by the prescription of the medical practitioner only. And if they are taken without that, that is illegal. Okay, so the needless use, okay, unnecessary use of some drugs without anyone's prescription is the drug abuse in the simple terms. But there are some drugs which can be taken without any prescriptions. They are called as over-the-counter medications, like paracetamol is there. You can take without any prescription. But the prescription drugs, they are to be taken on prescription only, and if you take without that, then that is illegal and that is drug abuse. Okay, so what all are the drugs that can be abused? The drugs which are commonly abused are opioids, cannabinoids, and coke alkaloids. The majority of these are obtained from flowering plants, and some are also obtained from the fungi. Okay, so the opioids are the class of drugs that include illegal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription, such as codeine, morphine, and many others. So these all drugs are used in the field of medicine, but only on the prescription. But people take them without prescription and they abuse them. So just see, there are different kind of such medicines which are abused, or drugs which are abused. Mainly they are they affect central nervous system or the cardiovascular system. So let's take an example of a drug that affects the central nervous system. Okay, two drugs. So there are some drugs which are called as depressants and others which are called as antidepressants. Okay, so depressants are the drugs which are used to slow down the nervous functions. Okay, to slow down the functions of the central nervous system. So there are some patients in which the nervous system is unnecessarily working. Okay, in epileptic disorders or in some disorders, there is some problem with working of the central nervous system, so we need to depress it. Okay, so therefore the depressants are given. Now just suppose, now in that person the nervous system activity was in positive scale, therefore we needed to bring that down to the 0 point. That's why we gave some drug which brings it down. Now let's suppose if someone already at the 0 point takes that drug, so what will happen? You'll go into the negative point. Okay, so such drugs, they are abused and people use them as sleeping pills. Okay, and there are another kind of drugs which are called as antidepressants. They're given to the people who are in in depression or negative thinkings, or such problems. So they are given to boost up the central nervous system functions. Okay, but if you take them at the 0 level, then your central nervous system will start working more and more. So they are used to enhance the performance by the athletes, some of the athletes, and also they produce a sense of euphoria. Okay, a sense of energy, a sense of well-being. That's why they're abused. Okay, so how do these opioid works? These opioids, they bind to the opioid receptors present in our central nervous system and the GI tract, and they just simply alter the functions. Okay, the morphine is extracted from the latex of poppy plant, which is scientifically called as Papaver somniferum, and there is something called diacetyl morphine, which is heroin, or also called as smack. Okay, heroin is a depressant that slows down the body functions and hence can be used as sleeping pills. Okay, then there are cannabinoids. They interact with cannabinoid receptors present principally in the brain. The cannabinoids are obtained from the inflorescence of the plant cannabis sativa, marijuana, hashish, charas, ganja. They are different things. They are obtained from different parts of this plant. Okay, you don't need to memorize that. And the most notable cannabinoid is THC, the primary psychoactive compound in the cannabis. You don't need to remember this name. Just keep this at the back of your mind, that if by mistake it comes in the examination, then you can just mark it. Okay, and these are known for their effects on cardiovascular system in the body. Okay, then there comes the coca alkaloids. Coca alkaloids are the alkaloids found in the coca plant, the ethoxylum coca. Cocaine is an example of that. So they basically interfere with the transport of neurotransmitter dopamine. So see, there are several kinds of transmitters, neurotransmitters. There are some stimulatory or excitatory neurotransmitters, while others are inhibitory neurotransmitters. So when they are released at the synaptic junction, some excite the postsynaptic neuron while others inhibit that. So dopamine is a kind of excitatory neurotransmitter. So these drugs, they interfere with the transport of that dopamine. Okay, it has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. An excessive dosage of cocaine causes hallucinations. Hallucination means perception of something which is not present there at the time. Like if you have undergone breakup and you take this cocaine, and you'll think that your partner is in front of you, and you'll start talking with that, and other people will think you're some mad or something, because they won't see that now. They'll see you talking to someone who is not there. So that is called as hallucinations. Okay, and hallucinations are also produced by atropa, belladonna, and datura also. And there are some other drugs also which are also abused, like nicotine, which is present very chiefly in the that tobacco. It may be chewed or it may be taken in the form of smoke by the cigarette or BD, cigar, etc., etc. Okay, then there are barbiturates, amphetamines, benzodiazepines, lysergic acids, diethylamides, etc., etc. They are also most commonly abused. Okay, then comes the smoking, which is one of the most prevalent thing in the society. Okay, I think the 1/7 of the world smokes. I'm not sure with the data. Just if you want that, you confirm that. So a lot of people smoke. So the problem is not just that the people smoke. The problem is that the people make others also to smoke. Like if there is someone who is smoking around you, then you'll also inhale that smoke. Okay, you'll also inhale that. So passively, you'll also be smoking that. So if one person smokes, he makes another 10 or 20 people to smoke. That's called as passive smoking. Okay, so how does the smoke cause negative effects on one's health? It increases the incidences of cancers of lung, urinary bladder, and throat. Okay, it causes bronchiectasis, that is the inflammation of bronchioles and the bronchi. It also causes emphysema, in which the alveoli of the lung, they are destroyed. It also causes the coronary heart disease and the gastric ulcer, etc., etc. So there are several deleterious effects of smoking. There are several effects of different other drugs which are abused. So see, people have this misconception that using these drugs will let them or will help them in facing the situation, but they don't know that they are just running away from the situation, and this doesn't help them. Okay, so that's it. In the next lesson, we'll be discussing about the effects of these drugs. Okay, thank you.